Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. We are talking to Dr. Frank Milnar, the CEO and President of Milnar Mentoring. Dr. Frank, welcome to the show today.
Christian, always a pleasure to be with you and to give information and education back to the profession of dentistry.
Wonderful. Frank, let's start out by talking about the new trends in the dental marketplace. And I think what we really want to focus on is, we're in the middle of a pandemic right now. The dental offices have now gotten the go-ahead to reopen on Monday. That'll be Monday, May 11th. And, what new trends can they expect to have to deal with, when they open the dental practice, both now and actually post-coronavirus?
It's called the unknown.
Yes,
welcome to the jungle. Okay. Lions and tigers and bears. Oh my.
Oh my. Yes.
So we're in the unknown. This is Star Trek. We're going to the edge of the galaxy and the nebula. But I have good news.
Wonderful.
There is an opportunity to shine, and this is where leadership counts. This is leadership time. This is not for the faint of heart. This is for somebody who can really understand and reassure your patients and your staff where you're going. What do they want? The patients want when they come back to the dental office, they want to be safe and healthy. They want to be safe and healthy. They want to be protected, safe and healthy. Safe and healthy. Did I mention that, Christian? They want to be safe and healthy.
You want to be safe and healthy. Got it.
If you miss this opportunity, your practice is going to shrink. If you shine, your practice is going to grow by word of mouth. They're going to talk about this, their first experience back in. They want to be safe and healthy. They want to know you know your stuff. They're going to look around. They're going to see how you touch instruments. They're going to see what you do, what your staff does. They're going to watch that. And they're going to make a gut feeling, can they stay in this practice or not? They want single appointments. They don't want to come back 3 times for an adjustment on something because the edge chipped or you got a stain on something. They don't want to come back and back and back. They want single appointments. They don't want your dental work to chip. Gee, he just put that in and I just ate something and the edge chipped off. I need to have a second appointment. Do you think that's going to work good for a patient? It's going to cost the doctor a heck of a lot of money for these revisits and rechecks. They don't want gaps. They don't want dark triangles around the gums. They don't want to see dark margins around things that they have to come back for a consult, a second appointment, to have you explain something that you did, and now you have to explain it. It's time and money and safety and health. They don't want you grinding down your teeth. Give me an option where you don't have to put it in a pencil sharpener and put a crown on it. They want somebody who's not going to amputate too much of their teeth. They want somebody who's going to save tooth structure and make something strong so it doesn't chip. They want an engineer. That's what they want. They want healthy, strong, stain-resistant teeth so they don't have to come back. Okay? What they also want is somebody who's empathetic, that understands maybe now's not the time to do the crown. We're just coming back in. Maybe we should just put a transitional restoration. Maybe we should take out the old silver filling and see what's underneath there. Maybe we should put a transitional glass ionomer or something in there to keep the tooth in the tooth bank. And then later on, when things settle down, we can get you back and crown the tooth and do something more definitive. But right now, let's keep you safe and healthy and save you some money. How does that work for you? Postpone costly, irreversible procedures. You get one time, they're nervous. They don't want to sit in the chair for 2.5 hours and have you go room to room to room, 3 hygiene checks and everything, and get you numbed up and you disappear for 40 minutes. They want to get in, They want to get out. They want to be healthy and safe. They want it affordable, that's price tested to their needs, their wants, their whys, and they want it right now. And they want to get out of the office and go back to the safety of their own home. Okay. What is the new normal in dentistry? The new normal is what doesn't work. Okay. What doesn't work as an educator, as somebody who does hands-on classes and mentors people, they don't want the wrong technique, that the dentist's not up on their clinical skills. They don't want the wrong preparation. They don't want the wrong composite, the wrong shade of the composite. They don't want somebody who's doing their old skills, putting 2 layers of millimeters at a time, playing patty cake on the tooth, and then the darn thing is sensitive. It doesn't work. They don't want polishing that is not good. They don't want to put their fingernail on the tooth and say, "Doc, my fingernail gets stuck on that ledge." What is that? They don't want now what you used to know. They want what the new normal is. Do it once, do it right. We want the right techniques, the new methods, the new techniques that are guaranteed that Christian White doesn't have to come back in for the 3rd time because the tooth keeps on chipping off on the edge. Okay? Not going to work. The new normal is not bonding. "Doc, you bonded that tooth." "Yeah, we did some bonding." No. We don't use that word anymore. We used engineer. We engineer. I will engineer your tooth, Christian. You said the other dentist tried 3 times to bond it. Here's the problem. Bonding doesn't work. Engineering and guided dentistry is what you want. I've studied engineering. I know how things work, how they fall apart, and how to put them back together again. We need to engineer the tooth to put our stiff materials onto the tooth according to the rules and principles of nature. It's not the size of the preparation that is important. It's the shape of it. How we could guide the materials into a place that is durable, safe, and how we can keep from damaging your tooth again and again and again. Christian, this is the backstory of dentistry that nobody wants to talk about, is drilling starts the death spiral of the tooth. Old Doc Adams, he put that big old silver filling in that tooth 30 years ago and never hurt. And then you took it out and you put that white filling in because you said the tooth was leaking and I was unsure why you wanted me to do it. And now it broke. Because you didn't explain engineering, you didn't explain sensitivity risk, you didn't do it, and now it gets worse. Now, Christian, that new filling I put, you said it was a big hole in the tooth, and now you filled it up with a white filling material, and now I can't bite on the tooth, I can't put cold water in there, and now you say I need a root canal. I'm really not happy about this whole thing. And go ahead, give me the referral, and then you see the chart leave your practice because the patient has walked down the street and he's going to find that patient will find somebody. Is that you have to explain to the patient that when you take 30, 40-year-old dentistry apart, this is the new clinical experience called the new normal of what happens. This was the new normal, is understanding the chemistry of the materials. If they're therapeutic, how do you heal it? How do you put something back that can have healing capabilities and save it for another day where there's an irreversible procedure coming in? You have to have guided, engineered dentistry. End of story.
Well, the new norm, just like you said. You got to pay attention to that.
Well, what else is new in clinical dentistry, Christian, is treatment planning, because you don't say to Christian White, okay, tooth number 3, crown buildup, tooth number 4, DO, tooth number 5, MOD, number 6, distal lingual, and then we'll take that up to the front and we'll get you scheduled. And our staff will talk to you about how much your insurance pays and what you pay.
Hmm.
That's the how and the what. No mention of the why. And that one goes probably in the wastebasket, I would think. What you really want to do is for a new treatment plan is you better understand that patient's world first. Jump into their world. You don't want them jumping into your world, is that you want to be compassionate. You want to understand their experience. Where are they now? How can I help you?
Hmm.
Where should we start? What would you be comfortable with us starting our first journey together? We want to support you and offer you the best safety, health, and experience where you don't have to come back a lot of times. I want to support you and help you grow. You and me can grow in a new dimension during the crisis here. That's treatment planning 101. That's going to reassure them.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal professional success of the dentist and his or her team.
I'm Frank Milnar, a dentist for 43 years. I'm the president and CEO for Milnar Mentoring, designed to make you more competent and confident with your clinical dentistry by receiving personalized mentoring, which reduces your procedure time and increases your profitability. I look forward to working with you in the future. The last part, Christian, that you and I talk about, because you deal with this day in and day out, is the relationship you have with that person sitting next to you, your dental auxiliary. I call it the CoPilot. You go ahead and start.
That would be the most important person to you. Maybe it's your right hand, maybe it's your right hand, your left hand. It's both. That would be your dental assistant. Oof, can't get much done without them, Frank.
Well, as a young dentist, I thought they worked for me. Okay.
Yes.
Please hand me this, Christian. Christian, can you go down the hall and get me this? Christian, can you hand me that Explorer? Can you go get that burr? Can you go get me that forceps? You see, you're working for me, and it shows to the patient.
Mm-hmm.
The best thing I ever did in my life was forget I was a dentist, and the person sat next to me who's been with me for 30 years, she's my right hand, she's my co-pilot. When patients come into my room on a consult and meet me, I said, I have great news. They say, what? I said, you're not going to meet me, you're meeting my co-pilot. She flies the plane. Everything we do together. She knows what procedure, what can happen, what materials. She has a voice, she has a vote. There's 3 votes.
Mm-hmm.
You, the patient, the dental assistant, and me, we will argue for the best possible result. I don't treat them as helpers. They're my partners. And I can tell you, in any young dentist, your job is not to get thanked. Your job is to have others get thanked before you. Your job is done. When they spend more time talking to your staff because they relate to them and how you treat them in front of the patients with empowerment, not punishment, that will define you. That's what the staff is all about. You do that, I think your road's going to be a lot easier.
Frank, there's a word for that. It's called edification. It's a really, really good word. And that sums up exactly what you just said. Um, that's a really important piece, and you've got that nailed down really well. Your dental assistant's been with you for 30 years. Not many people can say that, Frank.
My dental assistant, I'm going to say that's not who she is.
Mm-hmm.
She's my partner. I say that I mean it. I find new products to come in. based on my relationship with manufacturers before that product is inventoried,
Hmm.
before that product is implemented. We have a sharing session. This is what it does. This is why it is a good option in our practice. This is what you want to look out for. This is how you use it. This is how we work together, understanding chemistry. Because when the patient is gone, or when I'm gone out of the room, the patient and the assistant are there, what do you think they're going to ask? Wow, they compliment. The first time I work on somebody new, I said, you're going to get a chance to see an amazing person. Not me.
Hmm.
It's my assistant. She's my co-pilot. Watch her shine. Pay attention to her. I'll do my job, but pay attention to her. That's what they're going to find. And they find that very comforting to treat other people like that. Humility.
Yeah. Frank, do you find that because of the relationship you have with your dental assistant, that the patient feels that when they're in the chair? So when you're talking about possible treatment, the chances obviously the chances of them saying yes goes up astronomically. Do you find that?
Absolutely, because I welcome the opinion of my partner next to me, because she has a vote. She can talk. She's not going to contradict me. She's going to compliment me and strengthen my position with her acknowledgement that this is a good benefit for the patient.
Hmm.
How many offices, Christian, do you hear that dynamic happening at all?
Not very many, Frank.
Not enough.
Not enough. I've been in offices sometimes where, you know, kind of I I kind of put my head in the operatory and I duck because there's an instrument that went flying over my head, and that's no joke. Uh, so sometimes in those particular offices, they have a hard time keeping staff. Well, you wonder why. And people don't like to be treated like that, and they will not stay. They just won't.
What happens when you lose a team member sitting next to you? You just lost your best friend.
Boy, you got that right.
And to try to retrain and re-educate, I I can't imagine that. That makes me nervous just thinking about that possibility.
Mm-hmm. It's uh, it's it's a real pain in the butt because you lose the person who helps you the most in delivering the clinical dentistry that the patient needs to be healthy. It's not only the relationship that affects the dental practice, but it also indirectly affects every patient you see because they may not get the best care because when you're switching dental assistants all the time, there's no groove. You can't get into a neither one of you is comfortable with one another. It becomes really hard.
Christian, I'll put a ribbon on it this way.
Okay.
When I meet a new patient on a consult, I introduce the person sitting next to me. I said, you get both of us. Any questions, please call her as well as me. She can answer. She has solutions like I do. The other thing is I make it easy. If you're my first time after you've met me, I don't swing for the fences and try to do 8 hours of dentistry and see if we get it all done. I say, Christian, let's do something. Let's put a bet on the table. Let's make it a small bet. I want you to feel comfortable how we work together as a team, and let's do an easy procedure. So I get to know you, you get to know me. Let's make it comfortable before we go too fast and too far. And then I'll do a procedure. And then after it's wrap up time, I'll say, Christian, tell me what's different in this office versus the one you came from.
Ooh.
What I hear, Dr. Milnar, this was much more comfortable. You engaged me. You told me what's going to happen. You engaged the dental assistant next to you. They don't know what to call him, so they call him assistant. I thought I really liked the way you worked. Your hands weren't rough. You weren't in a hurry. You explained things, and you really made me feel at ease the way that you work with your team. What else can you ask for, Christian?
You can't ask for much more than that. You really can't. Whew. Frank, let me ask this question. For the younger dentist who, either is just coming into the profession or, has been in the profession for, less than 5 years, the ability to have that type of relationship with your dental assistant, how do you even start doing that? Because some of these younger dentists just, may not know how to do that. So just give us maybe a little bit of some tips on what you can do, just to start that type of relationship with your dental assistant.
First of all, change is difficult for dentists. They don't like change.
Mm-hmm.
I used to be a dentist until I became human. Okay, now I'm a human being. Is change could be either our biggest opportunity or our biggest threat. And when you change as a dentist, you don't want to be vulnerable. We're really uneasy and defensive when it comes to change. So, what I can use my story is that when I decided to make a wholesale change in the 90s, early 90s, and stop who I was and how I was behaving, I came to my staff, the person sitting next to me, and I said, there's a lot of change happening, and it's all going to be about you. I'm going to treat you a little differently. I want your advice. I want to be more empathetic, and I'm vulnerable to change. I want you to be aware of what's going to happen. There's going to be a huge benefit for both of us because we're going to evolve as a team. We're going to see better days. You're going to have more job satisfaction. The patients are going to be involved. Will you help me?
Mm-hmm.
Be vulnerable. Once they had the buy-in, honest, not because I was the boss, but once I became vulnerable and human, they wanted in. They wanted to be part of that.
Got it. All right. That's
Tough.
That's
It's
tough.
really tough.
That's hard for a dentist. Frank, that's really great information. Frank, thank you very much for being on the show today. The conversation that we just had, I think, is priceless in terms of a number of different topics that we touched. Thank you very much for being on the show today.
Christian, the bottom line is, what are you willing to give?
Mm-hmm.
What is the cost of change? What will it cost you in 30 to 40 years if you don't change? It will be so costly, it'll be catastrophic in cost, financially, emotionally, if you don't change. Yeah, it's going to be tough, no doubt. If you trust those people around you, they're going to support you on that. What is the cost? Not money. What is the cost to the person and the team around you? Thanks, Christian, for asking me the question.
You're welcome. Frank, what's the best way for our listeners to go ahead and get in touch with you?
Well, my website, www.milnar, M-I-L-N-A-R, mentoring, mentoring.com, or the email, Dr. Frank, Dr. Frank, at Milnar, M-I-L-N-A-R, mentoring, mentoring.com. Part of a mentor and an educator is to respond to the calls. And I'm always accessible. Thank you.
Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white and see you next time on the Dental Breakdown Show.